it was just not me, not me. I can't have cancer. I just can't. I've done all the right things. It was just disbelief. I didn't think it was possible. And my surgeon kept saying to me, I'm so sorry. I am so sorry.
I think that you're initially so kind of shocked that it's almost like you're numb. You just kind of do what you need to do to put one foot in front of the other and get through it.
And, it's my doctor, and she's like, you sitting down? I'm like, no, but I can. And she said, well, you have breast cancer.
A medical doctor didn't tell me I had cancer. After I had surgery, I woke up, and the first person I saw was my husband sitting at the end of my bed, and I could tell it was cancer just by looking at my husband's face.
And my oldest started to cry. My 12-year-old was kind of like, it didn't register to him. He was just kind of like, oh, so, what's that, and what's it all about, and asking all questions. And my 7-year-old, who happened to be sitting right beside me, I'll never forget, he was kind of like, snuggling up with me and all that. So we get to this part, and so, here's the word cancer. And he recoils from me, literally just pulled back, looks at me, and he goes, oh, don't breathe on me. I might catch cancer.
I remember it like it happened yesterday. The doctor had told me that he'd call me right after New Year's. So on January the 2nd, at exactly 9 o'clock in the morning, and we were getting ready to have a snowstorm. The snow had already started. The phone rang, and it was my doctor, and he said, bad news and good news. The bad news is it is breast cancer. The good news is it's very, very early diagnosis, and so we have lots of treatment options.
And cancer is so feared. It is, the unknown of it. And then, as my husband Van says, everything that came along was just a little worse than what we were anticipating.
My Metaport broke off and went through my heart. And that was a long day in March where they had to fish out 6 inches of tubing that had lodged in my heart.
My mom died of cancer about 10 years ago, and we, the family, did not find out about it until just before she was about to go into the hospital. And by that time it had spread throughout her body. I do know that at that time my mom had proper health care, but just did not go through the screenings that would have determined it early enough so that we might have been able to save her.
It was really my first experience with the death of someone that I was very close to, and it really brought the hard, cold facts and reality into my life, that there are devastating illnesses out there that people, suffer deeply from, and it changed my views and my perspective.
We know that the people who live in a higher socioeconomic status have better access to health care. There's no doubt about that. One of the problems that legislators like myself face is I represent an urban, an urban area. So where you have high concentrations of people many of whom live below the poverty line, they don't have access to health care simply because they don't have the means to pay for it.
The access to treatment is something that we still grapple with. Most people feel that because you're in an urban area that primary care physicians are easily accessible. Our rural areas have a tremendous time in getting physicians to practice in those areas, and they're basically rural, very poor, and so we have some of the same situations, some of the same issues, and so having physicians that want to practice in an urban area that's not affluent, wanting to go to a rural area and just roll up your sleeves and get busy taking care of the people in that area, that's a tremendous challenge for us.
This was a very early diagnosis that there was no way even a physician could have picked it up through a physical exam. It had to be a mammogram. If we'd waited another year or two, my treatment options might not have been as good as they were.
We are very privileged to live in a country such as the United States that has wonderful quality health care. Unfortunately, it's a disgrace that sometimes the health care only goes to the people who can afford it.
We've all seen cancer. We all know someone who has died of cancer, but we really need to take it a step further. We need to get involved.
I do know what it feels like to be near death. I really do. And I know what it feels like to just not be able to go another minute. And that, you know, when I can just keep on going and do one or two more things, that to me is just a real blessing.
And I survived.